Welcome to the WYN Legal podcast. In celebration of International Women's Day, WYN Legal have collaborated with several inspiring women who will be sharing their journeys with us today. I'm Binal Shah, a Senior Associate at WYN Legal. I'm very excited today to be joined by Dr. Jalali, who is a Clinical Director and Dentist at Tooth Club Limited. Thank you, Dr. Jalali. Thank you and welcome.
Thank you
for joining us. So I suppose if we kickstart by you sharing your journey, your background, journey to where you are now, and what led you to become a businesswoman within a dentist.
So everyone knows me as Sepi.
Okay.
My full name is quite difficult to pronounce.
I hope I got that right.
You said my surname and that was very well pronounced. Thank you. My full name's my first name's Sepideh, but everyone calls me Sepi. That was a challenge in school trying to get the full name right. But so I just went by Sepi, and that's what everyone kind of knows me as. And from the age of 15, I decided I wanted to be a dentist. I did my sort of school work experience, and I just loved being in the clinic, having your own team, your nurse, the sort of the patient journey. So kind of did the A-levels to get me into dentistry, worked really hard, got the grades, but dental school being very competitive, I didn't get in the first time round when I applied after A-levels. Being so sure, up until then, I'd sort of passed everything with flying colours, got into everything. So when it came to kind of not getting into dentistry, I kind of didn't know what to do. And I was very, very lost. And sort of clearing day came and I was like, I want to be a dentist. That's not going to stop me. So somebody said that if you do a science degree, you can then apply as a graduate for dentistry. So randomly, literally clearing day, confused as to what to do with A-levels. I applied for biomedical science in Portsmouth. I did that for 3 years. Absolutely loved it. A few of my friends were going there anyway, so I think that was kind of, that was sort of the influence of, all right, I'll go to Portsmouth. It's not too far from home. Lived there for 3 years, absolutely loved it. In my final year, I applied again and I didn't get in again. And I was like, okay, well, I'm not going to give up. I'm not going to quit. I thought I'll take a year out and I'll work. I'll save up some money and it'll be sort of a good way, just a bit of a break. Took a year out, did various jobs. Again, actually absolutely loved it. And then I applied again for the third time round and I got into 2 places. So it kind of worked in the end. Yeah. But I always thought I'm going to be a dentist, like one way or another, even if I keep applying. It was just such a big passion of mine. Got in the third time and got into a graduate school. So instead of the 5 years sort of normal route of dental school, it's 4 years. So because you've done a medical degree first, you kind of go into year 2. Again, a very good university up north, UCLan, a very small dental school that kind of, really, really watches you grow. So you kind of can't, there's only 30 students, so you can't just kind of be in the background. So that was that. And I'm originally from London. The dental school was in Preston. And then after year 1, you then get sent out to remote areas where they need dentists so you can sort of help patients. And I got a letter saying I'm going to Carlisle. Had no idea where it was. And being from London, anything outside of M25, you're like, well, where is that? So put it in Google Maps and it was right below Scotland. So I did literally, gotten from down south near the coast to up north. Again, absolutely loved it. It was I literally would not change anything about that journey. And then graduated in 2017. Worked in NHS and private for 4 years. Loved it, but it sort of just became a bit of my bread and butter. I could kind of do it with my eyes closed. A lot of routine treatments. And then an amazing opportunity came up at Tooth Club. They were opening private dental practices, and I applied and I got a job in Loughton in Essex. Moved there in 2021, very completely outside of kind of my comfort zone and what I was used to, going from something that I knew that I could do with my eyes closed to something that I just had to stay up and study and do extra courses because it was a lot more cosmetic based and patient sort of expectations were very different. But again, as I've sort of shown, I don't give up, I don't quit, so I just kept going and just fell in love with it. A couple of months, once I kind of felt comfortable and it felt like actually I was really making patients happy, literally.
You joined as a clinical director?
No, I joined as a dentist.
Oh, you
Yeah. So 20.
Your way up.
Yeah, correct.
So how long have you been there?
I've been there for 4 years, exactly 4 years. 2021 is when I joined as a dentist. And then exactly a year later, the old clinical director, for personal reasons, kind of had to step down. And I guess and sort of my boss had kind of seen that I sort of really want this, I have a lot of passion for it. Yeah. And I applied for the clinical director role and I got it. And again, completely outside of what I know as a dentist, because as the director, you've got to have a lot of more different hats on.
Was the business acumen.
Yes.
A dentist wouldn't have.
Exactly.
Is that quite challenging in terms of, I suppose, going back to the theme for International Women's Day and gender equality? Did you find that being quite male-oriented?
Yes, I think definitely not within our business. I felt really comfortable within Tooth Club, but I think sometimes going to certain events, I did have a bit of an imposter syndrome, I think, being kind of a younger and looking, which I normally get, that I look younger as well, kind of the smaller, the sort of petite. I could see that when I used to introduce myself as being the clinical director, there was a bit of a shock in people's faces, and a lot of the times I do get asked, how old are you, and people sort of and that's also with patients, I could see, especially in my old job, older men walking in, especially, and I mean, I even got asked, are you sure you can take my tooth out? And, are you strong enough? Or how long have you been a dentist for?
So not just, so that's quite interesting. So not just as a businesswoman, as a director, you got asked, but also as a dentist.
Yeah. I always took it as a compliment because I thought I'd look younger than what I am. Yeah. And I used to say that to them, or even if they didn't say it sort of up front, I think afterwards they would say, I didn't think, you could do that, or I did. And again, they were saying it exactly. Yeah. So, and it made me feel great. I kind of proved them wrong. So, but in the business aspect as well, yeah, definitely. I think a lot of, when you kind of go to these conferences and you speak to other people, they're either kind of, I guess, older women or older men. So sometimes, again, like I said, you've kind of really got to prove that even though you're early within your
challenge.
Yeah.
So how do you think you overcame that challenge? What do you think you needed to do, or that got across that line?
I think just accepting that I wasn't taking it personally. I wasn't sort of feeling down about it. Like I said, a lot of the times it was a compliment. I felt like, actually, you think I'm young, so thank you.
It's a good,
At the same time, I am very open about the fact that I am still young within the industry, and I'm still learning and I'm still growing. So I will learn from others. And yeah, I think I just kind of got my...
being small doesn't...
Exactly. Yeah. I kind of just got my head down and kind of got on with it. And with a lot of peers that I work with, many sort of different years of it being in the industry, I've just learned so much, and I've tried to adapt. I'd listen to podcasts and watch videos as to how, and I do love it personally when I go to conferences and I see a lady get up on stage. It inspires me. And I kind of look at them and I'm like, how do they carry themselves? So that people actually listen to them, because it can be very easy to kind of, be a little bit more timid as a woman and kind of be quiet and not have your voice heard. But so, yeah, I think it's just about growth, and it wasn't easy at all. And I think, a couple of years ago, I probably couldn't even sit down and talk to you about this, but I think just with experience and putting yourself,
you do it
absolutely outside of your comfort zone.
Yeah,
that's what you've got to do.
Okay, so what does the future hold for you in Tooth Club? You're looking to do, I don't know, to kind of build a brand a bit more, or what?
Yeah, I mean, look, Tooth Club is growing. We've got 14 practices and kind of growing. My role as a clinical director is increasing, so I'm sort of working less sort of the patient face aspect, more in the clinical director role. And to be honest, every month is a different challenge. It's, initially it was a lot more being involved with the dentist, and now I'm actually part of growing the business, what we can do. Yeah, very exciting. I'm learning so much from all of my colleagues that I work with, but just, I mean, in terms of the future, just to continue with Tooth Club and, make them grow and make both dentists and patients love dentistry. And that's sort of always been my passion.
Cool.
Both sides, absolutely, yeah.
So then what advice would you give to young women out there, I suppose, because you've been on the journey and you've overcome all the challenges that you say you faced. What's one piece of advice you'd give them?
I would just say, whatever it is that you want to do in life, just really wholeheartedly kind of, go for it.
So with your dentistry, you didn't give up.
No,
become a dentist.
Yeah,
so you went for it.
Yeah, so so many, even starting the new roles as a dentist in Tooth Club, that was it was so different. It was a challenge, but the reward and the everything that you feel after you've achieved it, it's so worth it. And I think just don't give up. Go for what you want. And imposter syndrome is normal, and
yeah, I mean.
Yes, and kind of, feel the emotion and go through it, but everyone deserves to kind of, get to where they want to be. And actually, what I have found is women do support women a lot, I think in the world and definitely in this industry. I know there's some negative connotations of, women kind of like to put each other down, and maybe that does, of course, happen, but absolutely, yeah. But I think find the right people and they will motivate you and influence you to want to be better.
Okay, thank you.
Yeah.
Thank you very much for joining us. And thank you for watching. Stay tuned for the next episode.
Thank you for having me.